there are cases surging in this country, notably in Ontario and in Quebec. 3 more regions in Quebec will be deemed red zones as of midnight tonight. Carleton-sur-Mer, Nouvelle, and Maria in the Gaspé region, all coming under stricter public health guidelines because of case numbers going up in that area. So what does that mean? It means a ban on indoor private gatherings, and restaurant dining rooms and bars will be shut down. These are the same regulations that are already in place now in the Greater Montreal area, in the Quebec City area, and in the region just to the south of that, Chaudière-Appalaches. Laura McQuillan is with us looking at the Quebec picture. It's now consistently recording 1,000 new cases per day. The government is trying to bring those numbers down with a number of new moves. So, Laura, tell us the very latest.
So some new measures are expected to be announced today, Heather, and those are going to target sports and schools. Let me take you through the sports to begin with, because this is getting quite a lot of attention this morning. Team sports and contact sports will not be allowed in those red zone areas you were just mentioning. Our colleagues at Radio-Canada have learned this from a public health working document, which says that individual sports such as running or yoga will still be allowed, but say you went to something like a gym, locker rooms and shared spaces other than washrooms would be closed. This is also going to affect schools because, of course, kids playing sports in schools, to this point, they've been having class bubbles and sports bubbles, but now they'll only be allowed to have class bubbles. So any sports will have to take place within that kind of cohort arrangement. Some other measures coming for schools as well that our colleagues at Radio-Canada have learned about. The Education Minister expected to announce that masks will be compulsory in schoolyards in those red zone areas. Not yet making masks compulsory in classrooms, though François Legault, the Premier of Quebec, has put that on the table in recent days. We're also expecting an announcement on attendance in high schools, which could see class sizes cut as well. That announcement expected to come at 1 p.m. today, Heather.
In Ontario, Laura, the issue that really is front and center still is testing and testing capacity. It's not sufficient, and that's affecting other areas of Ontario's COVID-19 strategy. Where is the Doug Ford government on testing right now?
Well, anyone trying to get a test from now on is going to find it more difficult. Up until the weekend, you were able to get a walk-in test, but now there are no more walk-ins. You have to get an appointment, and you can't get an appointment today. You'd have to look at tomorrow, but I want to show you what happens when you do try to book that online. I went to the Ontario government's website for this morning. I had to click through some of the hospitals offering these appointments. You scroll down, you choose your date, you look at tomorrow, and there's nothing available. It's already all booked out. So then I thought, I'll have a look at Wednesday, see what happens. And it tells you you've got to come back after 7 p.m. tonight to try and get that appointment. So imagine what's going to happen at 7 p.m. today. A lot of people will be frantically refreshing pages trying to get in for tomorrow. Now, that's just one hospital. There are a myriad of them, all with different systems. Some telling you to call, some saying book online, some booked out right through Wednesday as well. So experts are warning that any case counts for the next couple of weeks will be unreliable because it's going to be so much harder to get tested. One hospital, in fact, telling us that they're going to be doing 180 fewer tests per day. That's at one hospital. So that will add up. And also contact tracing is something that's being restricted as well in Toronto. Toronto Public Health saying it simply can't keep up with the numbers it's now seeing because it would contact one person and tell them they've got a positive result, but they just don't have the manpower to be able to call all of that person's contacts, now saying call them yourself. And this morning, Toronto's top doctor, Dr. Eileen de Villa, was on CBC Radio's Metro Morning, and she spoke more about that contact tracing. She said with such a backlog of cases in Ontario's labs, it's now around 79,000 cases or tests outstanding to have the results come back, contact tracing isn't actually that effective when there's such a delay on getting your results. The number of positives that you may have passed on could really be a runaway. And here is more of what she said in that interview.
The delays in test results, by the time they actually get to local public health officials and they can then start their case management to identify contacts and then do contact tracing, you know, the proverbial horse is so far out of the barn that that's not the most effective deployment or use of resources to protect people in the fastest time.
So right now contact tracing will be on hold in Toronto except for congregate settings like hospitals or schools or long-term care homes where you can have the greatest efficiency of contacting people traced to one case. Dr. Eileen de Villa calling on the province to put more measures in place, new restrictions for the next month, just to get those numbers down so contact tracing can keep up with that demand as well, or asking the province to give her new powers so she can put new restrictions in place. We haven't heard anything on that front from the provincial government as yet, but we are expecting an announcement this afternoon from Premier Doug Ford, his Education Minister and his Health Minister, so we'll keep you posted on that, Heather. That's also taking place at 1 p.m.
Laura, thank you very much. Laura McQuillan with the picture in the provinces with the highest number of cases.